Hello class, I'm Ed Mamita Jr., a nurse training officer, and today I'll be talking to you about the international patient safety goals, and I'll be using audiovisual aids, specifically PowerPoint slides and videos as my teaching strategy. So here are our learning objectives for our lesson today. First is to analyze various international patient safety and health standards. Second is to become familiar with the criteria for developing hospital rules and procedures. Third is to describe each IPSG's rules and regulations. Fourth is to be aware of the standards of our hospital's policies and procedures. And last is to adapt to any standard revisions based on Joint Commission international standards. So the purpose of the International Patient Safety Goals is to promote specific improvements in patient safety. The goals highlight problematic areas in healthcare and describe evidence and expert-based solutions to these problems. So our number one priority is safety. IPSG will help us to promote improvements in our process, to discuss the challenging areas in nursing, and give solutions like writing and making policies, guidelines, and protocols. So international patient safety goals. So our goal number one is to identify patients correctly. Goal number two, improve effective communication. Goal number three, improve the safety of high alert medications. Goal number four is ensure safe surgery. Goal number five is to reduce the risk of healthcare associated infections. And goal number six is to reduce the risk of patient harm resulting from fall. So due to time constraints, I will first briefly discuss the first three of our six international patient safety goals. So that would be identify patients correctly. Goal number two improves effective communication. And goal number three is to improve the safety of high alert medication. So let's talk first about identify patients correctly. So for the intent of this one is to reliably identify the individual, including comatose patient, with no identification as the person for whom the service or treatment is intended to match the service or treatment to that individual. So as part of our IPSG number one, so we should have at least two of the following identifiers. So our first identifier is the patient's full name, and the second one is the patient's date of birth. So this is actually a reminder. Patient's room number or location cannot be used for identification. So we cannot use the patient's room number, location, wing, or any part of the hospital or letters. So support consistent practice in all situations and locations of the hospital. So failures to correctly identify the patients can lead to, first is medication error, second is transfusion error, third is testing error, and fourth is wrong person procedure. Next is improve effective communication. So failures in communication are one of the most common root causes of patient safety incidents. So effective communication in healthcare organization. Effective communication is an essential element for providing safe patient care that occurs when a message is exchanged between two or more people. The essential elements of the effective communication: the sender must deliver a clear message and the receiver must actively participate in understanding the message. For the standard of improved effective communication, there shall be an effective process communication between patient, family, and healthcare providers. And the intent is to reduce errors and improve patient safety through timely, accurate, complete, unambiguous, and comprehensive communication. So our next policy is about verbal and telephone orders. So verbal and telephone orders shall be limited as much as possible. So whenever telephone order is made, complete order shall be documented, read back by the receiver, and shall be confirmed by the individual giving order. That is our attending physicians. And for medication orders given by a telephone, the nurse shall spell out drug's name to avoid mixing up with the sound alike drugs, and shall be expressed numbers in teens by pronouncing each digit separately. And the nurse shall request the doctor to countersign or his or her order as soon as he comes to visit the patients within 24 hours. So this how should a telephone order written? This is an example. And this is the exact example of telephone order written in the physician's order sheet with read back and signed properly. And this is another example of text order with confirmation text from our nurses. And for the reporting of critical laboratory diagnostic test results, critical test results shall always be referred immediately by the staff charge nurse to attending physician once available. So all high and low test results of the following tests are considered critical. For example, the results of glucose, potassium, sodium, phosphorus, bicarbonate, magnesium, calcium, CKMB, troponin I, lactic acid, SGOT, SGPT, BUN, CREA, amylase lipase, TSH, lead, pH, and PO2. Those critical tests shall be always referred immediately to our attending physicians. And for the effective handover to nurse to doctors, nurses shall relay any relevant assessment to the patient's attending physician. So nurses shall communicate critical information or situational briefing when dealing with the doctors about patient care. The ISBAR framework shall be focused to help focus the information and eliminate irrelevant information. And these are the following elements. So this is the ISBAR framework that we use to communicate with our doctors. So first is I, which is the introduction. So tell who you are, your role, where you are, and why you are communicating. S is for the situation, what is happening at the moment. And B is for the background, what are the issues led up to the situation. And A, assessment, what do you believe the problem is. And R, what is your recommendation? What should be done to correct this situation? And the third one of our IPSG goals is to improve the safety of high alert medication. So high alert medication and system safety, high alert medications are medications that bear a heightened risk of carrying a significant patient harm when they are used in error. So for the standard, improve the safety of high alert medication. Safety of high alert medication shall be improved, and the intent is to ensure patient safety when giving medication as part of patient treatment plan. And these are the rights in giving medications using the acronym of Dear Patient Red. If we are going to count it, it is like 12 rights in giving medications. So D for documentation, E for evaluation, A for assessment, R for reason, P for patient, T for time, R for route and refuse, and E for expiration date and indication, and D for drug and dose. So what are high alert medications? So these medications that carry a higher risk for adverse outcomes when used in error. Look alike and sound alike medications. So what are our top 5 examples of high alert medications? So number 1 is concentrated electrolytes, potassium chloride, sodium chloride, magnesium, sulfate, ferrous sucrose. So these can cause arrhythmias and can lead to cardiac arrest. And number 2 is insulin, severe hypoglycemia, and that is fatal. Opiates and narcotics, oversedation, respiratory depression, confusion, lethargy, nausea, vomiting, and constipation. And for the chemotherapeutic drugs, this can cause hypersensitivity reactions and life-threatening toxicities. And for the heparin, when used in error, it can lead to bleeding. So policy that The safety of high alert medications. So, number one is for medication ordered through telephone, the nurse in charge shall verify the ordered medication with the ordering physician prior to requirement to avoid confusion over sound alike drugs. And there shall be a designated cabinet for high alert medications, red tag for and a sound alike for yellow tag and look alike for blue tag drugs. The head nurse shall responsible for safekeeping of the key to open the designated cabinet. So this is an example of our cabinet for high alert medications. And these are the sample lists of HAM or high alert medications and silent and sound alike medications. And these are some example of high alert medication in physical. And these are some example of look-alike medications. You can see that they have the same boxes, look-alike medications, sound alike, and look at the packages. They also have the same. Okay? And that's all. Thank you, and God bless.